We know that policing spend a huge amount of time. They reckon about 40% of police time is spent on supporting individuals with mental health, and quite often they end up in custody, which is the completely wrong place for them to be. So I'm working very closely with my PCC colleagues and colleagues in the Home Office to say, well, how can we divert these people away? How can we work with our local health partners to get them into the right place of safety, where they are getting the right treatment and the right support and not ultimately being criminalised? In Merseyside, we are working really close. We have a mental health triage team, a liaison team, and they work really closely with the mental health trusts to make sure that nobody who comes into custody in Merseyside is put into custody. They go into the right place where they can get the right support. This is an ongoing challenge because we know the pressure that NHS trusts are under to try and make sure there is sufficient capacity for mental health beds, so it's an ongoing piece of work. In order to actually tackle crime, what we want to do is when individuals are coming into custody, we do a proper assessment, we understand why they're there, we take an opportunity to see whether we can defer them away and whether we decide not to charge them, but actually make them go on a programme where they can tackle some of the underlying issues, or maybe look at how we can divert them into restorative justice so they can make reparations without criminalising them. So actually, custody is a real hub of where people might come into the criminal justice system, and we want to be as proactive as possible to look at what we can do to stop them ever coming there again.